immediate effect to enable them to practice their lawfully chosen profession or specializations and subspecialties. 2. All resident medical doctors in training with the Ghana College of Physicians and Surgeons and West African College of Physicians and Surgeons, especially those pursuing programs in laboratory medicine, should be granted unfettered or full access to all relevant laboratory spaces within the various teaching sites in the Polybook Teaching Hospital, Cape Coast, Konkwanochi Teaching Hospital, where these residents are currently not allowed to pursue their training by the Medical Laboratory Scientist Group and its members. 3. All other forms of threats, including but not limited to murder and bodily harm, harassment, and assault directed at these laboratory physician residents and specialists, should cease forthwith. The GMA takes a very serious view of these otherwise criminal activities at the workplace that are directed towards our members by the medical laboratory scientists. The Ministry of Health and the various hospital management should also ensure the swift prosecution of the perpetrators of these crimes. 4. When push comes to shove, the GMA, its members, may be forced to reject laboratory results without authorization by qualified laboratory physicians at the point in time. 5. The GMA calls for a broader stakeholder consultation to look at the draft national laboratory policy. 6. The future of the medical profession is at a crossroad. The GMA calls on all of its members to be resolute in our quest to ensure that sanity is restored to the practice of the noble medical profession. The GMA reserves the right to respond appropriately if these negative and criminal tendencies by members of the medical laboratory scientist group and other allied health professionals continue at the workplace unchecked. The GMA hereby serves notice that the aforelisted resolutions, if not fully addressed by the Ministry of Health and its agencies, especially management of the various hospitals, will result in the GMA taking drastic measures that will definitely disturb the current seemingly industrial harmony and healthcare delivery throughout the country. This is a commitment that the GMA and its members will never waver on. Long live Ghana. In essence, the laboratory has become a no-go area for postgraduate medical doctors in training, a development which has dire consequences for the training of our specialist doctors. Misinformation by Ghana Association of Medical Laboratory Scientists. 1. The claim by the local chapter of GAMELS at Konkwanochi Teaching Hospital that the 2 hematologists were posted to the laboratory to head the unit is entirely false. 2. The view that only medical laboratory scientists regulated by the Allied Health Professions Council should work in hospital laboratories to the exclusion of all other cadres of laboratory professionals, especially laboratory physicians in Ghana, is erroneous and ill-intentioned. 3. They have deliberately misinterpreted the provisions of Part 1 of the Health Professions Regulatory Bodies Act, 2013 Act 857, albeit wrongly, to stop scientists with backgrounds or expertise such as clinical hematology, clinical biochemistry, clinical immunology, human biology, molecular genetics, clinical microbiology, pathologists, or laboratory physicians who are not under the regulatory mandate of the Allied Health Professions Council from working in the various laboratories in clear breach of the provisions of Act 857.